The Newsday continues here on One News Now. I'm Charles Lejano. A molecular lab in Cagayan is overwhelmed by the rising number of COVID-19 suspects whose samples need to be tested. Meanwhile, crematoriums in Biñan, Laguna are also burdened by the increasing number of COVID-19 deaths. JC Cosico with the details.
Aldrin is the only cremator on duty in this crematorium in Biñan, Laguna. He admits that his work has become heavier as more cadavers are being delivered each day. Most of the remains are of COVID-19 patients.
Siyam po kada araw, pero bumababa po minsan. Sa pagpasok pa lang po ng patay, napakahirap na po.
Because of fear of virus transmission, many of Aldrin's workmates decided to resign. But bodies for cremation continued to pile up. As of now, Biñan records at least 2 COVID-19 deaths per day, according to the City Health Office.
Tuloy-tuloy yung tawag sa amin. Plano naming mag-close ng 5 p.m. pero may tatawag sa amin, pwede po bang pa-cremate po ng body na to, COVID positive po, within 12 hours kailangan ma-cremate. So wala kaming choice kundi tanggapin.
The crematorium is so overwhelmed. Freezers for cadavers are also full.
Yung capacity niya talaga, hindi na niya kaya at kailangan niya ng lead time. Dahil for a cadaver to be processed, I don't know, for the cadaver to be fully cremated, mga 3 to 4 hours ang kailangan.
The local government of Biñan bought its own freezer to store the overflow of cadavers. They expect to receive it this week. For the meantime, there's still enough space in Biñan's columbariums and cemeteries, which means they do not need to prepare a mass grave anytime soon. If crematoriums are overwhelmed in Laguna, this molecular lab in Tuguegarao is also having a problem handling the rising number of specimens for testing. This comes as the provincial government intensifies its testing efforts as cases surge in Cagayan. With that, the number of specimens being brought to the molecular laboratory has also increased. Municipal health workers have to fall in line just to deliver samples.
Halos by the 100 po ang dumarating na specimen sa amin. Ngayon pa man, tayo pa rin po ang dagsaan ng mga specimens dahil dito sa ating molecular lab, meron po tayong 4 na machine na ginagamit dyan. No? Dati kasi, nung wala pa itong surge, no? Kaya po namin hanggang 600 to 800 specimens a day. Pero ngayon, dahil nga dyan sa maraming contact tracing na ginagawa, talagang tumaas din yung volume ng specimen na tinatanggap natin. Kaya medyo bumagal po yung turnaround time.
The number of new COVID-19 deaths in Cagayan has remained in double digits for more than a week. The current death toll is 632. Like other LGUs, Governor Manuel Mambas ordered the preparation of mass burial sites. There's no crematorium in the province, which means they have to rely on the one located in Isabela.
No, and I am now also asking, I have asked my provincial engineering, no, na maghanap dun sa mga properties namin ang pwedeng gamitin na mass burial site kung sakaling hindi kaya ng town, pwedeng dalhin dun, no, any time of the day para makapag-operate.
Tuguegarao City has the most number of active COVID cases in Cagayan Valley, with more than 1,000. Governor Mamba says he kept reminding the LGU to develop a new strategy for quarantine, as current home quarantines do not seem to be effective in controlling transmissions. For the governor, it's best to open up an isolation facility in the city so the community will not be compromised and hospitals will not reach full capacity. Tuguegarao Mayor Jefferson Soriano, who's currently in isolation due to COVID-19 exposure, explains they do not want to open up an isolation unit in their barangays due to a lack of manpower. Soriano also believes that an isolation facility could lead to more transmissions. For News 5, JC Cosico, we are One News.
The Presidential Anti-Corruption Commission assures the public that it is now taking action regarding the COA's latest audit report on the health department. In an interview with Radyo 5, PACC Commissioner Greco Bellica said they are validating the information received from the commission. Although Bellica admitted that they have yet to file a case against the DOH for these supposed irregularities.
PACC at saka ang COA po, meron na pong operational relationship yan eh. Meron po kami, pumirma po kami ng MOA na yung aming mga ahensya, pag sila po ay may mga findings sa mga ahensya na papasok, babato po kagad nila sa amin for investigation and case filing. Sa pagkakataon pong ito, wala after submission ng mga dokumento, resibo, etc. etc. At nagkaroon ng notices of disallowance, nag-issue ang COA ng disallowance. Yun po ang magiging basis for a corruption prosecution.
In the same program, Budget Undersecretary Tina Canda also shed light on the issue of the department's purchase of expensive COVID-19 supplies. Canda explained that at that time, the prices of face masks and face shields were higher due to a rise in demand.
So ang tinitingnan na lang namin ngayon, kung ang presyo na pinasok ng PS at that time competitive with the current rate at that time. Mali na ikumpara yung presyong bili noong kasagsagan ng demand na walang supply.
The U.S. is set to roll out booster shots by as early as next month. But an expert from Johns Hopkins Center for Health Security says not everyone may actually need a booster. Jennifer Nuzzo discusses more on Bloomberg Surveillance.
If we do anything to put ourselves back to normal, to go back to our lives, it is to get vaccinated. There is nothing new in the data that suggests otherwise. Heard a lot of news yesterday about the potential need for a third dose. I will tell you, most people, including myself, think that the data aren't quite there to suggest that most people need it. There are clearly some small groups of people that absolutely need extra help, and that's the immunocompromised, and they're already able to access a third dose. But as far as people broadly, we're not yet convinced that that's happened. The bottom line is the vaccines are still doing exactly what they need them to do. They prevent us from getting ill enough to get in the hospital, which, again, if this virus couldn't do it, we'd never hear of it.
Dr. Nuzzo, then when do we stop caring whether we get infected? Because right now, I'll tell you, I'll be honest, as a vaccinated individual who has a child at home, and I sound like a broken record, who is not vaccinated, I care as much about getting infected as I do about getting very sick, just simply because this will affect the people who I care about. So when does that change?
Sure. So I think that's exactly a potential off-ramp for caring about getting infected. I have also unvaccinated kids at home because they're too young, and hopefully when vaccines become available for them, that'll lessen those worries. But getting a third dose doesn't necessarily prevent you from getting infected in the first place, so that's unfortunately not going to ease those worries for you.
Dr. Nuzzo, there have been reports about new antibody therapies coming out of China that have actually been somewhat promising. How much does that potentially provide a game changer here where we can actually combat this and treat it more like a regular illness?
I think that's one of the missing areas that we need more progress on is treatments, because there will be still some breakthrough infections, but also we know we have a lot of people who are not vaccinated and are going to need treatment. So that is, I think, an important area of research. We have some things now, but they're not very scalable. You still have the monoclonal antibodies you hear about. You have to go to a center and basically be hooked up to an IV. And so it's very hard to deliver that at scale, particularly given the number of cases that we have. If we could give somebody a pill and treat them, potentially even at home like we do for influenza, I think that would have an enormous contribution to lessening our worries about this virus.
Six Filipino para-athletes are now all set for the upcoming 2020 Tokyo Paralympics. The athletes were given inspiring messages in a virtual send-off hosted by the Philippine Sports Commission. They're expected to bring home the bacon following the successful campaign of Team Philippines at the Tokyo Olympics. The Pinoy para-athletes will compete in swimming, taekwondo, powerlifting, and athletics. The Summer Games will take place from August 24 to September 25. Here are some of the send-off messages received by our para-athletes.
Your participation here shows to the world that anything is possible through hard work, determination, and solidarity. Rest assured that the entire nation is behind you as you compete and show your capabilities.
I'd like to wish all of you the best of luck. I hope that the success of our campaign in the regular Tokyo Olympics would rub off to you.
Here's a quick look at some of today's headlines. Metro Manila, Laguna, and Bataan will revert to Modified Enhanced Community Quarantine, or MECQ. Senators slammed the budget and health departments for their purchase of overpriced face masks and face shields. And it's coronation night for Miss Supranational in Poland. Miss Philippines Dindy Pajares eyes the country's second Miss Supranational crown. And those are the top stories at this hour. Join us again later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.